All right, unless I'm wrong, I make it. So I'm going to try and get started. We're still waiting for a couple of people, but in fact, I think they're coming in right now. So can I welcome you all to this evening's Health and Adult Social Service Standing Scrutiny panel, the first of the new municipal year. Welcome to everybody who is watching on YouTube, which might not be a lot of you, but good evening to everybody. I'm Councillor Katherine Crawford. I chair this panel. And it's my great pleasure to welcome back Councillor Fabio Conti as the new Vice Chair of the panel. And we look forward to working with Councillor Conti as we did when he was previously on the panel and on the council indeed. So there is a bit of housekeeping to do before we get into the main business. I'm going to start with apologies for absence because I have apologies so far from Councillor Murtagh and Councillor Byrne. I'm not aware of any other apologies from councillors. Does anyone have any other apologies they need to give me? I'm taking complete no, so I'm going to move on in that case. Suffice to say that our colleagues from the NHS can't be with us for all of the meeting this evening, so Anna Bryden, the Director of Public Health for Ealing Council, is going to do most of the presenting with Kerry Stevens this evening. We will take up some questions with the NHS following the meeting because it's not ideal that they can't be here tonight. I'm not aware of any urgent matters. None have been put in front of me for me to determine whether they're urgent or not. Declarations of interest. We need to ask if anyone has a declaration of interest to declare. It gives Piotr is indicating at me. Piotr, please.
Just to say, I see that there's a summary of COVID on the agenda today, and also opening of adult care. Is that on today? Yes. Although I'm here on behalf of Ealing Community Network, I am General Manager of Ealing Community Transport. And so I'd just like to say that we've been involved in the transport of mobility impaired people to the COVID vaccination centres. And we also have some work with Ealing Council transporting adult people with learning difficulties to some of the day centres as well.
Okay, thank you. So it's really the same arrangements that your predecessor Anna was involved with. So yeah, I don't think it's a pecuniary interest. So don't worry about that. Councillors, anyone else need to declare an interest? I'm taking the silence again as no. Please let me know if I've missed anybody. I'm not aware of any matters to be considered in private. So we can move on to the minutes, which are on the green pages of the agenda, the minutes of the 28th of April. And I'm aware that most of the people who are on the panel wouldn't have been at the meeting on the 28th of April. So I need to ask you formally if we can agree those minutes. It's slightly bizarre, but please can anyone let me know if they've got a problem with me approving those minutes? Again, I'm taking that as a no, so thank you very much. We need to approve the co-option arrangements and work programme for the panel in order to carry out our business. We've heard already from Piotr, who is the new nominee from the Ealing Community Network to succeed Anna Whitty, who has retired. So Piotr is very welcome. And I don't know if you'd like to just say, you've probably just done it. I don't know if you'd like to say a few words in introduction of yourself, but please, if you want to.
Okay, just very briefly, so I don't take up most of the evening. I've been at Ealing Community Transport for only about a year and a half now. I came in just as COVID struck, so it was a wonderful christening for me. Before that, I have been involved in the voluntary sector for a long career with St John Ambulance as a volunteer. But apart from that, it was 25 years at Stanley Black & Decker and 7 years at De La Rue, printing Her Majesty's money. So quite a varied career, and I'm ending it with community transport.
We're very happy to have you. And we're proposing that Matthew Von Mel Jones will continue as the Health Watch Ealing representative. He is the operations manager for Healthwatch Ealing, and we've worked with him over the past year. He's nodding at me, so I think I've got all of that right. But I don't know if you want to say anything, Matthew, at this point.
Yeah, thank you very much. Just that I'm thrilled to be a part of this panel for another year, and really look forward to it. So thank you.
And as in many previous years, we've asked Alan Cook, our esteemed observer of local health services, to continue as a co-optee on this committee. He's brought great insight over a number of years. We'd like to continue working with him. And since I've asked everyone else, Alan, is there anything you'd like to say at this point?
Only thank you very much for inviting me back.
Well, we've got to approve you first, so hold your horses.
Yeah, that's the point, isn't it? The fact that you've put me forward. Thank you.
Indeed. So I'm going to do this in two parts. We'll talk about the work programme in a minute. I'd like to just ask the meeting to approve those 3 recommendations for co-optees.
Yeah, agree. Fine with me.
Thank you, councillors. I'm going to take that.
Agreed.
Thank you, Councillor Midder. Thank you, Councillor Steed. I'm going to take that as agreement. I just want to say something very briefly about the work programme, because there are some things laid out in the terms of reference and then in the framework for the work programme, and some items filled in on the work programme, but they're by no means final. What I propose to do is work to the terms of reference that are in there and not change those, but to meet with Councillor Conti in the coming days to discuss what the work programme should look like. If colleagues have any suggestions or recommendations or things they want in or out, they can let us know as well. And I'd like to ask you to approve those arrangements so we can carry on. Thank you. I've got a couple of murmurs of agreement, so I'm going to take that and run with it, which, if everyone is amenable, takes us to our main item this evening, which is about an update on COVID in Ealing and the reopening of the adult social care services in Ealing. Anna-Marie, we're having some difficulty with Anna's IT. Are you able to share these slides?
Yes, I can do that. It'll just take me a minute or so. So if Anna wants to talk over while I find them, that's fine.
Anna,
Thank you, everybody. Thank you, Chair.
Anna or... Yeah, go on, Anna.
Yeah, I can start. Thank you. Apologies, my IT is not happy today. So just going to take the committee through the COVID update. I'm also going to include the vaccinations update in there. Sincere apologies from NHS colleagues, just under immense pressure this week in terms of the vaccinations programme. So I've said I will cover for this evening, but obviously can take back any comments or questions to our NHS colleagues, and also including the care homes update in there on behalf of Kerry. So I'm just going to talk through a few of the key points, just in terms of the current situation nationally. So we have experienced significant declines in rates, deaths, hospital admissions over the last couple of months, and it has been relatively stable at quite a low level over March, April, and early May. You will have seen, I'm sure, in the media, we are starting to see over the last month, particularly a bit of an upturn in some places in the country, and that includes in northwest London and some other London boroughs. Thank you, Anna-Marie, just on slide 3. You are just starting to see that. So on that little graph on the left at the bottom, you can just see a slight upturn there. That really masks the differences across the country. So in the map on the left, the blue areas are the places with highest rates. At the moment, as an example, we're seeing Blackburn having a rate of about 500 per 100,000, which is similar to where a lot of the country was in, say, February. So some areas really are seeing quite an increase, and others not at all. Next one, please, Anna-Marie. So in terms of the situation in Ealing, we are starting to see that increase here as well recently. We are seeing about 200 residents per week at the moment testing positive. So that's a rate of about 58 per 100,000. It's higher than the average across London, and we are at the higher end. I think we're 4th or 5th highest in London today. But a number of other boroughs, not just in North West London, are showing quite high rates at the moment, and some increases, especially in South London. Very positive news that we haven't had any COVID-related deaths in the latest week of data. But we are starting to see some care homes, for example, and one of the earlier setting with outbreaks, not seeing the same impact in terms of hospital admissions, etc. at the moment, but obviously keeping a careful watch on there. Next slide, please. So really just wanted to talk to the committee about what's now known as a Delta variant. So I think I've mentioned before at this committee, viruses change over time, they mutate, you get new variants, that's entirely expected. One of the ones that has been identified recently and was originally identified in India is now known as a Delta variant, and that really has very quickly become the dominant variant in the UK. In Ealing, as well as other North West London boroughs, we were one of the areas with that increase at an earlier stage than other areas of the country, but now an awful lot of the UK is seeing that same pattern. In the last few days, the government has confirmed that they think this variant is about 40% more transmissible than the Alpha or the Kent variant. And you are seeing that locally, where you are having households with all household members testing positive, for example, which is relatively unusual for other variants. I think really importantly, there's no firm evidence at the moment that this variant causes more severe disease, and definitely no evidence that the vaccines aren't effective. But I think really importantly, very, very early evidence is showing that both doses of the vaccines are particularly important for this variant. So it's something we are really trying to encourage our local residents. The data that's published weekly, if you look at that, you'll see that just over 100 cases in Ealing. We know that's now higher, and we're just over 200 cases in Ealing. And like a lot of other London boroughs, we saw this variant first in communities where they'd been travelled to India. So we were particularly seeing around Southall communities the variant at the beginning, whereas we're now seeing pretty much widespread community transmission. It's now accounting for over 80% of all cases in London, so affecting all ages, all ethnic groups, etc. We aren't seeing that impact on local hospital admissions, and that's the same across London. And we've got very, very low cases and deaths in our local care homes. But one thing we have been undertaking, and we are in the middle of this 4-week period, is another programme of surge testing. So we've done 2 programmes of surge testing earlier in the year, both in terms of the South African variant, and now undertaking this for this new variant. And that really is a borough-wide approach, really encouraging all our residents to undertake testing where we can, and with some additional resources into Southall particularly. So at the moment we are doing a number of different activities. In terms of especially testing, but also really upping our communications and engagement activities as well across the borough. We are carrying out some testing in secondary schools around Southall particularly, and we have got a roving testing unit again that's moving around different sites in the borough, with some element of door knocking support there as well. And if anybody goes to one of our testing sites for people without symptoms, they're not just being offered the rapid test, they're also being offered one of the PCR tests, which gets sent off, but that is more accurate, and it also comes back with analysis of which variant somebody might have tested positive with, so really gives us a better understanding of what's happening locally. So you'll see from that slide that we've got really decent numbers of tests being done over the last week or so, and we're into our 3rd week of that testing. Next slide, please. So just wanted to remind the committee about our testing options generally in the background. So for people with symptoms, we've got 3 local testing sites, and obviously people can access those sites in other boroughs as well, or people can offer home testing kits. And for people without symptoms, we really are, along with our national colleagues, having a real push to try and encourage everyone who's getting out and about now to try and get tested twice a week. We all know that a lot of about a third of cases of people testing positive haven't had any symptoms, and so this is really to try and protect everybody and their family and friends. We've currently got 6 testing sites and 12 pharmacies. People can also collect boxes of tests that they can then do at home, or they can order them online. And there's also a number of employers and workplaces as well carrying this out. So there's a lot of options there. And the information on our website tries to take people through those options and show them the easiest routes. Next slide, please. So just wanted to update the committee on our contact tracing. Since we last spoke at this committee, we have changed our model. We're talking about something called Local Zero, which essentially just means that instead of waiting for a day or two for the NHS contact tracing service to get in touch, and if they fail to do so, they would then pass the information to us locally. We are now doing all of the calls, and so we can get in touch with somebody within a couple of hours of having had their positive results. And we're seeing really good progress with that, really good success, where we've got a success rate currently of over 90%, which is great. We've also added in a pilot around doing some door knocking. So if people aren't responding to a number of calls, an email, a letter, etc., our colleagues in housing are supporting us to go and do a personal visit to really try and encourage people to engage with the process, and also to offer that support around self-isolation. And also the contact tracing team has been really great recently. They've been offering some support with calling some of our homeless communities to invite them for vaccinations. But we've also carried out recently about 8,000 calls to residents who we know from NHS records haven't been vaccinated, really just to have that conversation with them, be there to answer any questions and offer to help book the vaccination if that's wanted as well. I think that's that slide. Thank you, Anna Marie. Next one. And then moving on to vaccinations. So our NHS partners are leading on this with an awful lot of support and joint working with the council, where across Ealing the progress is great. We've done almost 200,000 first doses, and over 100,000 people have had second doses, which is great. We are seeing inequalities and uptake continuing, especially in some of our more deprived communities. So, for example, Acton as a whole has relatively low rates. Among men have lower uptake as well, especially now we're getting into younger ages. And some of the Black ethnic groups and some of the mixed ethnic groups have lower uptake as well. So we're doing an awful lot of engagement work to try and engage with communities, have those conversations, and really try and provide trusted sources as well. Our two main sites, well, our main sites now are CP House on Uxbridge Road, and we've also got 9 pharmacies across the borough, which is great, and that's higher than a lot of other North West London boroughs. So really provides options for our residents. The primary care staff who were running the Town Hall and Dominion Centre, that work's now come to an end as we reach the over 50s and offer those vaccinations, but there's sufficient supply and resources in those other sites. And like I said, a lot of those pharmacies have only started recently. The government is now offering vaccinations to anybody over the age of 25 from this week, which is great. And we're hoping that will open up to 18 and overs relatively soon. So they can either book or they can walk into a local centre that's advertised for first dose. And the other thing that the government is really trying to encourage is if somebody's got their second dose coming up, to bring that forward to 8 weeks rather than waiting for 12 weeks. So a lot of people might have been contacted by the NHS to do that. As we are seeing that case rate go up, and we are seeing the higher numbers of the Delta variant. The NHS is also supporting and working jointly with us in terms of surge vaccinations. So, for example, we've got extended hours at the main site, additional supplies going into pharmacies this week. We've had a number of small pop-up events. So, for example, we had one of the Southall Gurdwaras. We've done some smaller events in Northolt, and we've done a very large walking event with over 1,000 people in the centre a couple of weeks ago, which was really, really positive. And we've got other plans for June and July. We are slightly tied in terms of the NHS supply of vaccines. So we've got plans in place and setting up staffing, etc., and ready to go. But until we get that nod from Central NHS that the supply is definitely coming and we can go ahead, we can't necessarily advertise it, which obviously does limit some of our engagement. But doing what we can to really support local people through both the normal vaccination opportunities that are out there and also some of these bigger walk-in events. Next slide, please. Kerry, I don't know if you want to talk to this one.
Yes, and I'll just bring my video on. So in terms of the care home situation in Ealing, as presented to this committee in the past, Ealing's got the 5th highest number of registered care home beds in London. We've got the highest number of care home beds in North West London. We're a net importer of people into the borough generally. In terms of care home placements, the council's been working very closely with our partners in the NHS and in the provider sector to provide support to the care home market throughout the pandemic, and continues to provide that ongoing support and regular meeting with care home managers. The position in the last week is that we've moved to a single care home which is now closed to new admissions due to COVID outbreaks. That's bucking the trend. For the last 8 weeks we've not had any care homes closed, so it is a concern that one care home has had an outbreak and we've had to ask them to close their doors to new admissions. At this point, we're not aware of anybody in that care home who's had the infection having significant health problems as a result of that, and we put a lot of that down to the significant levels of vaccine uptake, and Ealing is currently top half and top quartile in some areas in terms of vaccination provision within the care sector. So that's as of the 4th of June. As of the 4th of June, 78% of Ealing Council and the community provider workforce have been vaccinating. 76% of the care home workforce have been vaccinated, which is a significant piece of work, and 73% of the home care workforce have received their first vaccinations. You may recall at previous meetings, Chair, that we said there was a big concern for us in terms of reaching out to people working in the home care sector, and we're really pleased that there's been such significant progress within this area. Anna-Marie's asked me to also update on the daycare situation as part of this slide. The council's working closely with our partners to open up the daycare settings in COVID secure ways, and my understanding is that all providers have now reopened their services and are continuing to provide assurance to us that the service offer is protecting both staff and customers coming in for those daycare services, and also that the 2 internal services, so there's the Michael Flanders Day services, which is in Acton for people with dementia type illnesses, that isn't planning to reopening in the immediate future because we're also using that site as a testing centre, and there are plans to open the Cowgate Day Centre for people with learning disabilities in the next 2 months. The delay of opening Cowgate isn't COVID related, that's been due to some building works that are required to be done to reopen the service. Back to you, Anna.
Thank you, Kerry. And Anna-Marie, if we can go on to the final slide. Thank you. So just wanted to run through some key messages, I think really important for committee members and local residents to be aware of these and to help support everybody in taking them forward. So obviously we're still under some of the lockdown restrictions and waiting to hear about the 21st of June easing of restrictions. Again, if somebody's got symptoms, self-isolate at home and get a test either by going to one of our local testing sites or ordering it online. And also really encouraging people to take part in the surge testing that's going on. Really important to understand what's happening with the new variant, but more importantly, if people don't have symptoms or might only have mild symptoms, really to identify them, support with self-isolation and really protect friends and family. Support is available and from our Healing Together service, so really encourage people to access that. And then importantly, for our kind of long-term protection, the vaccinations, anybody over 25 and over, they don't have to wait for an invite. They don't need to wait for a text from the GP. They just need to go onto the NHS website or access some of the walk-in clinics that are happening around North West London. And information will be on the council's website and social media if you want to have a look at that. And I think really importantly, even if you've had your vaccines, please continue with the general preventive messages and really following those normal safety guidelines about washing your hands regularly, wearing a mask where it's required, giving everybody space and really carrying on with that really good social distancing and opening the windows. Thank you, Chair. Very happy to take questions.
Okay, thank you, Anna. I'd ask colleagues to indicate if they can or put in the chat that they'd like to ask a question. Councillor Conti has done that, and I'm going to come to Councillor Conti first.
Thank you. I just had a couple of questions. The first thing was on so the asymptomatic testing. I was wondering, because there's been 113 cases, I think you said, of the Delta variant. I was just wondering how many of those were picked up through, sorry, not through the surge testing, and how many of those were picked up just from people coming forward because they had symptoms to be tested. So just in terms of, I guess, trying to equate the effectiveness of picking up asymptomatic COVID cases through the surge testing. That was my first question. My other one was on the asymptomatic testing. I think I can't remember on the slide now how many asymptomatic tests have been carried out, but I was just wondering, has there been a drop-off? Because if you look on the .gov website on the number of tests carried out each day, there's been a real drop-off over the last few weeks, especially in the number of lateral flow tests. And I just wonder whether people are getting weary of doing these. And I'm just wondering what we've seen in Ealing, especially if people in terms of attending or visiting one of the asymptomatic testing sites. And then my final question was just on care homes and the one where the outbreak was. I was just wondering whether that reflected any significant difference in the rate of vaccination within that particular care home that may have contributed to, whether there was a spike or whether, in terms of potentially why that care home has seen an outbreak.
I was going to say we'll move on to other questions, but there's quite a lot there from Councillor Conti. So let's take all of those as a block and then go on to the next set of questions.
Thank you, Chair. Thanks, Councillor Conti, for that. So in terms of the question about the surge testing, how effective it's been, we don't yet know. So we have had quite a large number of surge tests done. The 113 Delta variant cases, they are being picked up primarily through symptomatic testing. We did also, so that they are since April and May. So this has been over a few weeks, and obviously the numbers have risen quite rapidly in the last couple of weeks, along with a lot of other London boroughs. We did do a small amount of surge testing in one primary school in Southall a few weeks ago. So there is a chance that some of the numbers will be from there, but it really is just widespread community transmission now that we're talking about. Our surge testing has been running for a couple of weeks. We've had a lot of people go through it, which is great, but we won't yet know the results from that. We will find further cases within that number, but they will just add to the background rate and really help us to understand how widespread that is in the community. You're right, Councillor Conti, the numbers of people testing through our asymptomatic testing sites have really dropped off over the last couple of months, and that's the same across the country, and it was expected. I think part of it is that people are kind of no longer understanding the need for it and are stepping back from thinking it's as important, and we're really trying to encourage that message to get out there, really trying to encourage people just to have it as part of their daily, part of their weekly plan, that they do these tests twice a week. I think really importantly though, back at the beginning of the year, these testing sites were the only place you could get these tests, where now there's lots and lots of options. So you can go and collect the kits, especially from a lot of pharmacies or those testing sites, and you can also order them online directly through the government website, get them delivered to your home, and again do them at home. And we don't have records, we don't get the data of how many people do that locally, which is a shame, but we understand they are being taken up quite well. So we do have to think carefully about what we might want to do with our testing sites going forward, really keep that access out there, but also make best use of resources. In terms of the care home outbreak, I can start on this. Kerry might want to come in. Most of our care home residents, you'll see from Kerry's data, have been vaccinated. We haven't got reason to believe this care home is different. We are looking into the particular circumstances, but don't have any serious concerns at this time. But Chair, I don't know if Kerry might want to add to that. Thank you.
Thank you, Anna. Is it okay to come in on that point, Chair?
Yeah, sorry, I was just letting you do it anyway.
Thank you. It's an absolutely valid point, Councillor Conti, in terms of why have we seen an outbreak in this care home. We've been working very closely with the care home sector, and this certainly isn't a care home where we've had concerns about uptake of vaccine or following of infection prevention control protocols. So they were seen as a provider that was meeting all the standards and all the requirements that had been set for them. I think the positive piece of news about this is that the high level of vaccination within the care home is reducing the impact on the residents and on the staff group. Thank you.
Thank you. I just want to check that that's answered Councillor Conti's questions. Yeah, brilliant. Right, I've got Councillor Mohan, then Mr. Cook, and then Piotr is going to come in. So Councillor Mohan next, please.
Thank you, Chair. Anna, you have partly answered one of my questions. That was that in relation to PCR tests recently done, for example, in our ward, Lady Margaret ward. What was you have mentioned the number of kits or tests returned. Do we have any idea about the percentage of the response? And second question is when are we likely to do such a campaign again? Thank you.
Thank you. Anna, do you want to, since there are a couple there, do you want to take those? Let's do them all individually. So Anna, would you like to come in?
Yeah, thank you, Councillor Mohan. On the first question about the PCR tests done, we have had a lot return, which is great. We will have more. So, for example, a lot of the high schools in Southall this week have been doing tests for all students. At the moment, we don't yet have the results. As a general rule at the moment, where we're testing people without symptoms, you're only seeing about 1% testing positive. Whether that's going to change because of the variant and because of the surge testing, I'm not yet sure. And Councillor Mohan, I'm really sorry, I couldn't quite catch that second question.
It was that in terms of PCR tests, when are we likely to do such a campaign again, like door-to-door knocking?
Okay, thank you. Apologies. So we are currently doing some door knocking. We have been at the Westway, and we are going back to Southall outside the Lidl, I think, the next few days. So that's a testing site offering opportunistic tests and conversations on the street, and it's also got a team going out and doing some door knocking, having conversations with residents both and the vaccines. So that is happening at the moment for probably about another week. And in terms of anything in future, I think we need to get the learning from that, see how people are responding to it, if it's thought to be useful, is it something we might want to carry on with in some way. It's quite a resource intensive activity, but there might be an argument for carrying it on in some way in the future. Thank you.
Thank you, Anna. Who's next? Melanie, ready? You're on mute, I think. Yeah, you're off mute now. Excellent.
Hi. Thank you, Chair. You've talked about 113 cases of the Delta, and I assume the figures that were being given are actually cumulative over a period of time. However, in the talk earlier on, I thought you said there were 200 cases currently. Is that correct? And looking at the statistical data for Ealing, there are 219 cases. Obviously, they don't tell you what they are, from the 1st to the 8th of June. So could you just comment on that? Are these 200 cases part of that 219? And if not, what is the other variant that we are seeing that has been picked up? Thank you.
Okay. Chair, shall I come in and answer
Yes,
those?
please, sorry.
Right. No, that's fine. Sorry, my IT is still not very happy. Thank you for that question. The data is cumulative. So that 113 is the published data. It's only being published once a week, so it is quite quickly out of date. We are seeing over 200 cases cumulatively, and they are rising quite quickly. I think the important thing to note with those is because these are people who have tested positive, and then their tests are sent off to a very specialist lab that carries out the assessment of what variant they might have. That all takes a little bit of time. It's quicker than it used to be, but it does take another few days at least for that to come through. So the data is always slightly behind what's currently happening. We are seeing overall, regardless of the variant, we are seeing about 200 cases a week at the moment. That's increased quite a bit over the last week or so. And so that's probably similar to the 219 cases from the 1st to the 8th of June. That will be about the same data, give or take a day. And that will include a lot of variant cases. The data we're seeing from across London as a whole is that this new variant is now accounting for over 80% of cases across London. When you look at it across our borough, like I said, the data, there is a lag with that variant data. So I would imagine that the majority of those current 200 cases are this Delta variant, but we don't yet have that data to be able to say that explicitly. I hope that helps.
Yeah, did it answer, Alan? Are you happy-ish?
Yes, it did answer the question. What is happening? Slightly confusing when you in the presentation talk 113, and then later on, as I thought I heard, it was 200. It was just a clarification point of that, which I thought was important. Thank you, Chair.
Thank you, Alan. Piotr, you're next. Would you like to come in?
Yep, thank you, Chair. I've only got, well, it's really two questions about the asymptomatic centres. Now, obviously, I've got a number of staff from all over the borough, 100 about in total. And so I get a lot of feedback on these centres. Now, I understand the number of testing has gone down quite dramatically. And even amongst my own staff, most of whom have had both vaccinations now, they're saying, well, do we need to still get the twice a week LFD test? I don't need to do it anymore. So my first question is, what is the message to those people who've had both jabs, that they still and should still attend these centres or do them at home? And are we putting that message across? Is that the message the council wants to put across? And secondly, with quite a serious decline in use of these asymptomatic centres, have we got the finger on the pulse of when we would best be putting them back to their use as libraries or daycare centres or whatever? Or is there a danger that they will just carry on having very, very few clients and wasting resources?
Thank you for those questions. So if I just pick those both up. So yes, you're right. If somebody's being vaccinated either with one or both doses, we are out the very clear message to carry on as you have been with all the different COVID related measures, and that does include the regular testing. The vaccinations do give you very heavy protection. Then no vaccine is 100%, and a lot of the government messaging get that out there. The vaccinations are fabulous, and the uptake of them has been great, but everybody is still at some risk, even though that risk is substantially reduced, and also at some risk, even if it's small, of them passing it on to somebody else. So we are saying, even if people have been vaccinated, please do carry on doing the regular testing, especially if you are out and about, for example, for work. It is something that we do try and encourage people locally. If that message isn't getting out there, I think it's important for us to know and to have a think about what we can do better locally. It is something we've been pushing upwards to our regional and national colleagues as well, to really say that we need that kind of national message to really carry on pushing that as well. In terms of the declining use of the testing sites for people without symptoms, we are currently looking at that. We're hoping to have some of those options developed in the next couple of weeks for the next phase. When we last reviewed them, collection options weren't there, the online testing options weren't there, and they really have changed how people do the tests. Along with a decline in people doing the test, using the testing sites in any case. And you're right, some of these sites are running in places where they can run fine. Some of them are taking space that is usually used for other purposes. There is an argument for things like libraries, whether you could reopen them soon, but keep some of the collection off of there, so people could come in and pick up tests to use at home, even if they don't have the opportunity to do the tests in the sites. We are looking across all the options on that and really looking at both the best use of those sites, good access across our residents, including those maybe some of the communities that might be less likely to access testing generally, and really trying to work out the best use of resources. So definitely work that's currently happening, and we should have a clearer position in a couple of weeks. Thank you.
Thank you, Anna. I'll have Cllr Dhindsa next. Cllr Dhindsa.
Daniel, I want to say something after Dhindsa.
Okay, Councillor Miller, I've got other people, but I'll get to you as soon as possible.
Okay.
Cllr Dhindsa.
Yeah, thank you very much. Basically, my few questions are around the low uptake of vaccination among BME communities. I'm trying to understand, because most of the people I've spoken to, they all want to know how quickly they can get vaccination. And here we are talking about, the low uptake. What I'm trying to understand is there any data or is there any evidence which can pinpoint us, other than the narrative, which is that there is a low uptake among the BME communities, other than the narrative, is there any data or evidence to pinpoint that this is why it is happening? Am I making myself clear in this question? I hope I am. If not, then ask me, I'll elaborate. And the other question is, earlier on in one of the slides, there were unvaccinated calls made. Who were these calls made to? Was these the people who were invited initially and they didn't come, and hence we called them to find out why they were not coming forward for the vaccination, or they were simply random calls made? And the third question is around care homes. We were talking about 78% of the council and community workforce vaccinated. What happened to the other 22 or 23%? Why aren't they vaccinated? What's the reason behind that? Is it because they don't want to be vaccinated, or is there shortage of vaccination, or what? And so basically, the data and the evidence around low uptake and unvaccinated call and the council and community workforce, 22%.
Okay, thank you, Cllr Dhindsa. We'll take Anna to come back on the first two, and maybe Kerry for the last one, or a combination of both of you. Sorry.
It is very, so I don't like to talk about it in terms of lower uptake in some ethnic groups and some communities. They are in general on more deprived areas, and on the whole you are seeing lower uptake in communities with larger Black ethnicities, Caribbean ethnicities, mixed ethnicities, but you are seeing some places, we're hearing today, even talking to colleagues in other boroughs, You are seeing some very small communities that are really, really happy, for example, to get the AstraZeneca vaccine, and you're seeing, you know, in a neighbouring community, communities where they're really not. So that the reasons for that low uptake, I think, are very, very variable, and that's why our engagement work is so important on this. Really engaging with our local communities and our local community representatives to try and get the robust evidence out there, and really try and be a trusted voice, and really try and work with those community leaders to share those messages and have those conversations. In terms of the calls made to people by the contact tracing team, so that was a joint project with the NHS. It was using GP practice data on people that were recorded as not yet having had their vaccination. That could be for a number of different reasons, and during the calls we were talking to people about those. Some of it was very practical reasons, for example, they've been out of the country. Some of it was people, for example, not wanting to take the vaccines during Ramadan for personal reasons. Some of it was people that just really didn't want to have it, and the callers would try and have those conversations to answer some of their questions. So it was to people targeted who hadn't yet taken it up, and we were able to encourage some people to definitely take up that vaccine, and we're taking the learning from that to see if it's something we might want to do again. In terms of the care homes vaccinations, again, Kerry might want to come in a minute. We have been doing a lot of work over the last few months with our social care staff around vaccinations. Over the months, we do see relatively low uptake normally among some of these staff groups for things like flu vaccinations, and we do a lot of group work around vaccine hesitancy. Again, able to answer questions. With the COVID vaccination, a lot of myths have been out there on social media and shared by communities and residents, and we try to run a number of sessions and try and answer those questions. It's ongoing work. 78% in one way feels quite good in terms of things like normal flu vaccine uptake, but you're right, there's a lot of work still to go. I'm not sure, Chair, whether Kerry might want to add to that. Thank you.
Come in, Kerry.
Thank you, Anna. Thank you, Chair. I think it's worth noting for the Scrutiny Committee's consideration that national government has started a consultation with social care and social care providers about mandatory vaccinations within the sector. We think this would be a very challenging area to implement, and it would require changes in legislation and employment law to make this a requirement. As Anna said, we've worked very closely with NHS, public health and the provider sector to ensure that we can push as strongly as possible and to support people uptake the vaccine within the care sector, because we know that in terms of acting as vector for the infection into places where vulnerable people live, these group of staff are really key. And I think the work that showed that the statistics that show that in London we're currently above average in all areas is really strong, and a testament to the work of Anna and her team and our colleagues in the NHS.
Okay, thank you, Kerry. And it is important to, sorry, I don't know if you'd finished. I think you've finished. Yeah, okay. It is important to point out, because a number of colleagues wouldn't have been at the previous meeting when we discussed this, that when we previously discussed this, the vaccination rate, both sections of this care home staff cohort was very low, you know, below 50% or so. So we have made some progress in that area, but we all agree, I think it's still too low, and we'll be doing more to try and bring it up. Now, I need to ask some questions of colleagues. Two colleagues have put their hands up, Councillor Mohan and Mr. Cook. I take to mean they want to ask another question, even though we've already heard from them. Mr. Cook is nodding, and I'm gonna imagine it's not a legacy hand from you, Casey. In which case, I'll come back to you in a minute to ask those second set of questions. Councillor Midder hasn't asked her questions yet, so I'm going to come to Councillor Midder, and I'll come to you, Councillor Conti. I've got a question from Councillor Steed to get to, and then we've got to go to Roy Willis. So I'll try and remember all of that. So, Councillor Midder.
Thank you very much, Chairs. I have no question. I want to say thank you very much to the staff and the volunteer. They done fantastic job last week. I was there as a volunteer. Really, they done very good job with a smiling face. I appreciate they done well job. Thank you very much.
Oh, thank you, Councillor Midder. That's very nice, and I'm sure we can pass that on through Anna and Kerry to the various officers who've worked with the volunteers, and make sure we get that across. Right, Councillor Dhindsa wants to come for a follow-up. Councillor Dhindsa, I'll come to you in a minute. I need to read this question from Councillor Steve because I don't think he can ask it himself. And he acknowledges that this might be out of our sphere of influence, but he says that there's lots of anecdotal evidence that generally many people are now quite relaxed. For example, people on public transport not wearing masks. I appreciate this is outside the area of our health officers, but is there any discussion about this generally? Anna, would you like to venture an opinion about the need to continue wearing masks or not on public transport?
Yeah, definitely. Yeah, thank you. I think it comes back to some of the discussions we've been having about other measures like the testing. I think really important to keep getting the message out there that these are still required, and that they really do, along with a number of other messages, really help the prevention of transmitting the virus. I do hear that as well in terms of anecdotal work. We still have got our regulatory services officers out there working with local businesses and in town centres, the COVID stewards. We work directly with a lot of community voluntary groups as well. If you are seeing particular business premises or areas of high streets where you feel this is a concern, there is a COVID email address for regulatory services that we can share afterwards if that's helpful. And they're very happy to go out in response to concerns. But agree, we are trying to carry on with the normal messaging around the preventive measures, and that does include face masks. Thank you.
I think I muted myself. Okay, thank you, Anna. Right, I've got 4 colleagues waiting to ask questions. So I'm going to go back to Councillor Conti first. Councillor Conti.
Thank you. My question was that you mentioned about that you're now implementing people you can't get hold of on the phone by contact tracing, by that knocking on their doors. I was just wondering what sort of response you've got from that and whether that's been successful. And I guess my second question, sort of on a similar theme, is in sort of compliance with people, not necessarily once they've got a positive test, but maybe if they're concerned about symptoms and then waiting for a test result. And also if someone in the household's positive, in terms of compliance with the rest of the household isolating, have we seen any change in sort of people's attitudes towards that and whether that's become more difficult to enforce? I just think anecdotally, I've noticed from speaking to patients recently that potentially their views on that aren't as rigid as or strict as they may have been a few months ago.
Thanks, Councillor Conti. So in terms of the door knocking for the contact tracing, I don't yet have an answer on that because it's relatively new. We've only been doing it the last 2 or 3 weeks, I think. We are only seeing maybe, because the numbers until the last couple of weeks have been relatively low, we've only been seeing maybe 1 or 2 people a day that might require that. So it is quite small numbers, but I will try and get a proper update on that and bring it back to the next committee if that's okay, Councillor Conti. In terms of people's attitudes about self-isolation, waiting for test results, staying at home, I honestly don't know. Again, I've heard some things anecdotally from a number of partners that say it's becoming more of a concern. However, we heard from our contact tracing team the other day as one of our regular updates, and they were saying almost the opposite. They're saying when they are getting in touch with people, they already are self-isolating. They're very positive about the call. They're very positive about the offer in terms of letting them know about the Healing Together support, and it feels like people are kind of used to it as something that is now done rather than a new thing, but there will always be people that find it difficult for a number of reasons, especially linked to their jobs, childcare, etc. And a lot of people that don't test purely because of that. And that is a really, really difficult thing, and that's not local to Ealing. So we do a lot of work, especially with our engagement colleagues, around how we can support people to self-isolate. It's an ongoing area of work, though. Thank you.
Okay, thank you, Anna. Councillor Mohan.
Thank you, Chair. It's a quick one, Anna. The new variant, which is also called Delta, and there's a lot of talk about it. Does it involve same symptoms, or does it come with different symptoms?
Thanks, Councillor Mohan. So at the moment, there's no evidence to say it's got different symptoms. So entirely the same as normal. If people have a higher temperature, a new persistent cough, or a change or loss in sense of smell or taste, we would ask them to stay at home, self-isolate and get a test. So at the moment, we are seeing the same range of symptoms as for the other variants. Thank you.
Thank you. Thanks.
Okay, Mr. Cook. Alan.
Thank you, Chair. We've talked about vaccination of staff, and I'm wondering in the last 2 to 3 weeks whether you've noticed an increase in the number of staff coming forward. And the reason I'm asking this question is that I was at a meeting yesterday where LAS actually said that they found in the last 2 to 3 weeks staff who have been hesitating in the past are actually now coming forward. So I wonder what was happening in it, whether you've noticed this in Ealing.
Yeah, thank you. We are seeing our overall testing rate go up in the last week or so. Some of that will be the surge testing. For example, in the schools, we did almost 1,000 people, so that's quite a big hump for us. We are seeing the infection rate generally rising, and therefore people are more. There are more people with symptoms that need to go and get a test. I think with a lot of the media coverage, especially about the variant, and especially around Northwest London, I think there are communities that are really wanting to get tested and really wanting to take part in this. When we did carry out the early surge testing at the primary school, the head teacher was saying how the parents were very thankful. They really, really wanted to understand what was happening, have the opportunity to have the tests, learn if they had this variant, and really help protect their families. So I suspect it's really variable across different individuals and different communities, but we are seeing that increase generally in our testing rate in the last week.
Okay, thank you, Anna. Councillor Dhindsa wants to come for a follow-up.
Yeah, thank you very much. First of all, to Anna, my apologies if I failed to understand you. And I'm not trying to catch anybody out. I'm simply trying to understand behind the narrative about low uptake in deprived areas. The reason I asked the question, 4 out of the 5 wards in Southall are the most deprived wards in the whole of England. So I'm trying to understand this question. I can also understand people's preference to having Pfizer as compared to AstraZeneca. So I can understand that. Some people might say if a vaccination is being given on a particular day, they say, I don't want AstraZeneca, I want Pfizer. That is not reluctance to take the vaccination, that's a preference to take which one they want. So I'm trying to understand, is there any data or evidence, once again, which pinpoint the low uptake, because most of the vaccination was by invitation. So all those people were invited to come and take the vaccination. As far as I can remember, when I took my vaccination, I wasn't asked which group I belong to. I simply went up to the doctor and they just gave me an injection. So I'm just trying to understand, and a bravery badge as well. So I'm just trying to understand, what's behind the narrative. That's all it is, just to understand. And no more, no less. Thank you.
Sorry, go ahead, Anna, if you can. think we might have lost Anna.
Apologies, I'm back, sorry.
Lovely.
Can you hear me okay?
Yeah, we've got you loud and clear.
Great. Sorry, Councillor Dhindsa, I just lost the last 30 seconds and apologies. Let me try and answer the bits that I did here. The data we get isn't perfect on ethnicity. So a lot of it's from GP practice data, which again isn't perfect in terms of ethnicity data. So we're kind of doing the best we can. The uptake that we're seeing, it being lower in both deprived areas and in some ethnic minority groups, is similar to what we see for a lot of vaccinations for a number of reasons. We are seeing those same patterns for COVID. As I was saying earlier, within Ealing, the lower uptake is particularly among some of our Black ethnic groups, rather than, for example, some of our South Asian ethnic groups in Southall. You're right that there are some practical and preference reasons why people might not take now. For example, the supply of AstraZeneca is higher than Pfizer, and that's the same across the country. We have seen, obviously, the reports around some of the very, very rare health risks with AstraZeneca, and especially with the guidance for anybody under 40. There will be some people that want to have the vaccine now, are able to because they're now in those younger age groups, but are not taking up Pfizer. And so we are seeing some people have that preference. Unfortunately, we can't guarantee which vaccine people are going to get if they're over 40, and there will be some people that aren't okay with that. We also have seen recently, especially with our walk-in clinics, where we put on that large event, especially at the Dominion Centre in Southall, and the same in some other boroughs, where if you take out the barrier just in terms of somebody having to think ahead of book, and it's just walk in, you do get a lot of people you wouldn't otherwise have come into vaccine centres. When we ran that session at the Dominion Centre, over a quarter of people were unregistered and potentially undocumented as well. So those walk-in clinics really do reach people we might not otherwise reach, which I think is great. And we are hoping to run another couple of those kind of walk-in clinics over the next few weeks. I hope that helps answer the question.
Okay. I'm sure we can return to some of those issues at a later date or in the coming days via email if need be. I would like to go now to Roy Willis from Ealing Reclaim Social Care Action Group, who had notified us that he would like to ask some questions, principally around social care, I think. So I think these are mostly going to be for Kerry, but I'm not certain about that. Roy, are you with us? And are you ready?
Yes, hello. Hi, thank you.
Go ahead.
Can you hear me?
Yes, we can hear you fine. Go ahead, please.
Yes, I've tabled 4 questions, but I think the second one doesn't need to really be gone over again because we've talked quite a lot already about the vaccination rates in the care sector and in the BAME communities. So I had some general questions about social care. And the first one, which I think is quite important, is looking at the Association of Directors of Adult Social Services report that came out in May on the impact of the COVID pandemic on adults with learning disabilities and autism, and their family carers and their service providers. And that shows that there's been a huge impact from the pandemic on these groups and on their families. Nationally, there was a 134% increase in mortality amongst this group. And there's also the whole loss of contact with relatives, families, activities and routines during the lockdowns, and an overall decrease in the number of opportunities in supported employment sectors. Obviously, the report does say that there were some positive changes as well during the last year of the pandemic, more health and social services collaboration, creative outreach, more use of digital technologies, and more use of micro providers. I think from our point of view, this report should be very widely circulated and read and discussed. And the question is really, what are the implications of this report for Ealing's learning disability and autism services? And can this detailed study and its recommendations be the subject of a future report in your work program of the panel? So that's the first question. Do you want me to continue?
I think what we'll do, we'll take them individually, I think, Roy, if they're going to be.
Okay. Yeah, it's rather a long question.
Kerry,
I know.
Kerry's ready to respond. Kerry's ready to respond, so I'm going to hand over to him.
Thank you, Roy, for the question. Again, a very helpful question in terms of responses during the pandemic. In terms of what we're doing to look into the ADAS report and also a previous report produced across London called Abandoned, Forgotten, Ignored, which is about the impact of the pandemic on vulnerable groups, people with physical and learning disabilities, is that we're working with the partnership boards. We've got a programme of reviewing the impacts of the pandemic using the Abandoned, Lost, Forgotten report, and we can include the ADAS report within this. I've got an older adults and people with physical and visual disabilities meeting tomorrow, where we're having our first discussion with regard to the impacts of the pandemic, and thereafter a plan of including the discussions about the impact of the pandemic on the various groups within the partnership boards, including the mental health part and suicide prevention partnership board and the learning disability partnership board. I'd leave it to the chair to make a decision as to whether this is included in the work plan, but it's certainly something we're very actively looking at and are looking to develop learning from these reports and people's experiences in order to assure that services are prepared for any future waves of the COVID virus, but also learning in terms of service provision going forward. Thank you, Chair.
Thank you, Kerry. And I think for my part, I would wait to hear what some of that learning is from yourselves and your colleagues when you're taking those meetings. But clearly we would like to learn what we can and have a facilitated forum where some of that information can be shared and we can have a frank discussion about some of those things. So, you know, not having spoken to my vice chair or any of the other panel members, I might be getting ahead of myself here, but, you know, perhaps if we can create that space in an appropriate time, it would be useful to explore something around that. Roy, so you've got 2 or 3 more questions, I'm not sure now. So would you like to try the next one?
Yeah, 2 more questions. So I'll leave aside the question about vaccination because we've covered that already. The next question is really about shortages of care workers in the sector, and it appears to us that shifts in the employment patterns that meant that people who were being laid off from work in retail and hospitality sectors, it was anticipated they would move into social care jobs. However, this doesn't seem to be happening, and it may obviously be the case. It was the case, obviously, that there were shortages of care workers before the pandemic, but it seems certainly that the pandemic has exacerbated this. So the shortages may be due, and the lack of applications to the care sector may be due to low pay or shift work, lack of career structure, lack of childcare facilities, etc., etc. And we just want to point out that that's undermining social care services, and so that means that daycare centres, domiciliary care and respite care are not really able to reopen fully due to these staff shortages. And really wanted to ask if the council has noted these difficulties or any difficulties with applications and filling of vacancies, and wondering whether practical support, guidance and information can be offered to the care providers to address this. And there might be something like inviting people to a jobs fair trying to improve the image of care work generally. So that's really the question.
Is it okay to come in, Chair?
Yeah, just go ahead.
Yeah. Thank you for the question, Roy. In Ealing, we're not aware of there being any services not reopening due to staff shortages. If there are particular examples, Roy, I'd be very interested to hear about them. We can work closely with those providers in terms of their recruitment programming. Ealing's working closely with London ADAS around a recruitment campaign called Proud to Care, which is focusing on recognition for people working in the care sector and also recruitment to the care sector. I'm sure councillors around the table are aware that there's been significant challenges in terms of recruitment of staff into the care sector for a number of years, with increasing demand for services and reduced capacity in terms of staff resource. Some of this is due to Brexit, some of it is due to younger people not wishing to enter the care profession, and some of it is due to wages and reward, and that's something the council is actively looking at in terms of London Living Wage and the Ethical Care Charter. We're also looking at some shortages within service areas for social work recruitment, and we're working closely with the Community Care, which is a publication for social workers, to develop a recruitment campaign specifically targeting social workers to come to Ealing. A big part of our recruitment programme, whether it's in the wider care sector or in social work, is about staff retention, and we've been very conscious about that during the pandemic and the need to ensure that staff are supported. There's a lot of press interest and news this week with regards to burnout rates within the NHS and the pressures on NHS partners, which we're very cognizant of, but also colleagues who've been working within social care, many of whom have worked throughout the pandemic, whilst many sections of society have been locked down, have been carrying significant pressures. And we're conscious that we offer the support and access to services to enable staff to keep physically well and mentally well during such significant challenges. So in summary, Roy, I think you're absolutely right to raise the question. The work that we're doing with Proud to Care London is a really important aspect of recruitment and retention of staff, but also, more importantly, recognition of people working in the care sector, which I think is absolutely key. Thank you.
Thank you, Kerry. Thank you, Kerry.
Roy?
Yeah, shall I go on to the third question? Okay.
Far away, yes, please.
Okay. Well, as you've mentioned, Chair, this is the first scrutiny panel of the council year, and we were really trying to open up discussion on a number of other social care topics, and hopefully encouraging you to include them in the work programme. And these were issues like safeguarding, hate crime towards people with disabilities, co-production of care packages, charging for social care, and the future of residential care, given what I heard earlier that there's over 20% vacancies in the residential care sector. And also, I suppose we'd like to ask how social care users and their family carers can be consulted in the preparation of these and any other reports that are going to come before the committee, before the panel in the future. Thank you.
Right, so I think what we've got is best described as a skeleton work programme at the moment. You know, I take advice from colleagues on the panel. I take advice from officers with regards to what would be under consideration, particularly Mr. Stevens, when he provides ideas that could come forward. Some of those items that you've just listed are things that you've listed before, both in dialogue with me, in emails, and in previous contributions to the panel. So some of those will be under consideration. Well, I can't say that we're going to be able to take them all, but I know of your interest in those areas. So I will do my best to try and reflect that in what comes forward. When you talk about how users of the services, their families, carers, people can get involved in providing information. You know, I would say that what I've tried to do is be as responsive and open as possible. If people want to send me their thoughts, they can do, and we can try and use that as a mechanism for reflecting it. If people have particular contributions they want to make, we'll always try and facilitate that through the panel, whether it be through asking questions or to be a contributor on a particular topic. We can do that, and I can see that Kerry is wanting to come in, so I'm going to hand over to him, and then I may come back potentially. Kerry.
Thank you, Chair. I think it's an interesting point about how we engage with the partnership boards, which are the adult social care sort of engagement and consultation framework for a range of customer groups and people who use our services. I think some of the learning that we're potentially going to see from the review of the Abandoned, Lost, Forgotten report and the report that Roy mentioned earlier from ADAS, and presenting that to you, Chair, and to see whether that's a useful framework for engagement with wider customer base and the constituency groups there.
Yeah, so certainly I think what you mentioned, Kerry, in your earlier answer with regard to discussions you'll be having internally in the coming days, and then your consideration of a couple of those reports that Roy has mentioned and you've mentioned, I think we can come up with some answers. I don't think I'm breaking any confidences to say one of the things that the panel wants to consider more in the coming year is more social care related issues and reports, if that's at all possible. So I'm confident, Roy, that we'll be able to try and focus on at least some of those issues, if not all of them. But, you know, we welcome your passion for social care, and we want to try and facilitate that as best we can. It's just a question of fitting everything in, as it always is with this panel, especially given having less meetings than we previously did. I trust that answers your questions. Roy, you can always come back to me in the coming days if you wish, and I look forward to having that dialogue. I don't see any other indications from members of the panel to come in. Kerry, you've got your hand up. Is it a legacy hand or is it a... Okay, yeah, excellent. So I think we've come to the end of this section of questions. I'm just going to ask colleagues if they've got any questions, any more comments they'd like to make before we close up. Can I ask if anyone's desperate to make a point? I can't see anybody at the moment. So in which case, I need to thank you for your participation this evening and remind you that the next meeting will be on the 8th of September. And prior to then, Councillor Conti and I will be meeting to discuss what the work programme should look like, and we'd like all of your contributions into that process as well. So if anybody has any thoughts, comments or queries, do get in touch with us both. Thank you to our officers this evening, and thank you to all of you. We're going to have a little bit more of an earlier night than